Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. Dr. Pane, we have a question here from our Instagram crowd this week, and this lady she says she's a little bit over 50, thinking about a facelift, neck lift, and eye lift, and some skin resurfacing with the goal for a more youthful appearance. Dr. Pane, what would you recommend in this situation?
Well, here, person's 50, they're on the early age range of people that are seeking to do these kind of procedures. And we don't have a lot of great photos. We don't have perfect photos of the eyes, and it's hard to see exactly what's going on with the face and neck. But usually at this age, some degree of laxity will start showing up with the jowls, the eyes, and the neck as well. So all of that is potentially reasonable. Now, a face neck lift can be done. You can combine that with upper and lower blepharoplasty at the same time if desired. If the goal is to add some more volume to the face, then I prefer fat transfer, but it can also be done with implants. Some people do a great job with implants, and those are an option. That can be done at the same time. Where it gets a little tricky is how much are you going to combine that with lasering? Because when I think if they talk about the resurfacing of the face, they're really talking more about, they didn't specifically say CO2 laser, but there's a couple of different laser technologies that can be used. Some of them require monthly treatments over long periods of time, and others can be done at the same time as the facial surgery. Here, I would see what they were interested in doing. With what they're talking about, it looks like it's more of a surgery type answer. And I would say, why don't you do the surgical procedures up front? If there's to be laser done, I would probably limit that around the mouth area. I'm not a big believer in doing a lot of facial laser at the time of doing a facelift procedure. You can get into some problems with that. So I would say limit the laser at the time of the facial surgery, and then down the line, the rest of that could be done. Now, if the person does not want to do surgery, maybe they just want things to be refreshed, or they don't really have a lot of laxity or wrinkling going on, it may be all a laser treatment up front. And then you recover from that completely. And then, if desired, the surgical options can be added later. So those are the basic overviews of how we tend to approach this type of situation in our practice. This person would really need an in-person consultation, and then to get a sense of what they really want to do and what their preferences are in terms of they want more invasive, less invasive, surgery, not surgery, and how do they want to combine things. But that's the basic overview of all the major options for addressing this person's problem. The good news is they're likely to get a very good result, from what I can see and what I heard of the case from looking at what was submitted to us. So I feel pretty good about this one. I think they will do well.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please reach out to us via our website, Facebook page, Twitter, or by clicking on the link below. And Dr. Pane, we appreciate your time, and we'll see you on the next one.
Great.